You know, we talk about vaccines a lot on this show, but there's one that's been getting a lot of attention lately, a vaccine for herpes.
Interesting.
And we're going to take a deep dive into it today.
Sounds good.
We're looking at this article from Sexually Transmitted Infections called Why We Need Herpes Vaccines Now. Alarming new data revealed.
Oh, okay.
And we're going to figure out just what's making this such a big deal right now.
It's interesting, because it's not just about cold sores.
Yeah.
People think about herpes, they think of those oral blisters, but there's actually a whole other side to this virus that affects millions globally.
Right. Genital herpes.
Exactly.
And the article highlights that there's actually a connection between the two.
Right.
They talk about a rise in genital herpes caused by HSV-1, the virus that we usually think of as oral herpes.
Right. So we have these two main types of herpes simplex virus.
HSV-1 and HSV-2.
HSV-1 and HSV-2, exactly. And traditionally, HSV-2 was the one that was behind genital herpes.
Yeah.
But now we're seeing this shift. We're seeing HSV-1 kind of moving into that area.
So we've got these two types. Both of them can cause either oral or genital herpes.
Right.
What does that mean for someone who gets infected?
Well, here's the thing about both of these types.
Okay.
They're lifelong, and there's no cure.
Oh, wow.
Yeah. So there are ways to manage the symptoms. You can reduce outbreaks.
Yeah.
But the virus is always going to be there.
So even though there's no cure, they can still live normal lives.
Absolutely.
Yeah, okay.
People with herpes can live perfectly normal lives. And there are things they can do to manage the virus.
What kind of things?
Antiviral medications, for example.
Okay.
They can be really effective at suppressing outbreaks.
Oh, interesting.
Yeah, reduce the frequency,
Yeah.
reduce the severity of the symptoms,
Makes sense.
and they can also lower the risk of transmission.
Oh, okay. So they can still have healthy relationships and
Absolutely.
all
yeah.
that. It's really about managing it.
Okay, that makes sense. But then, we've got millions of people living with herpes.
Yeah.
We've got ways to manage it. Right.
Why are they pushing for a vaccine now?
Well, let's talk about some numbers.
Go ahead.
2020.
Okay.
The World Health Organization estimates that 846 million people
Wow.
under the age of 50 were living with genital herpes globally.
That's a lot of people.
That is a lot of people.
Like, what is that compared to?
To put that in perspective,
Yeah.
that's more than the entire population of Europe.
Oh, wow. That's crazy.
Yeah. And in that year alone,
Yeah.
there were 42 million new cases.
42 million
Yeah,
in a single year.
that's right.
So this is a big problem.
It's a widespread virus.
Yeah.
That's one of the big reasons why scientists are calling for this urgent vaccine development.
Okay. I'm guessing it's not just the number of people.
It's not just the number, it's also what happens when people get infected.
Okay.
So the article, it points out that in 2020, over 200 million people experienced at least one symptomatic outbreak.
So that means they're dealing with what, like sores and stuff?
Yeah, painful sores, potential complications,
Okay.
and then there's the emotional distress that can come with a herpes diagnosis.
Yeah, I can imagine. So we're talking about a real public health challenge here.
Absolutely.
Oh.
It goes way beyond just the individual impact.
So what would a vaccine actually change?
Well, a vaccine, it could prevent new infections,
Okay.
which would mean that a lot fewer people would have to deal with all that.
The physical, the emotional.
Exactly. The whole burden of herpes.
Okay, that makes sense.
Yeah.
But for the people who already have herpes, what would a vaccine do for them?
That's a good question. It might be too late for them to avoid infection,
Yeah.
but there's a chance that a vaccine could still make things better.
Really?
Yeah. It might be able to reduce how often outbreaks happen
Oh, wow.
and how bad they are.
Interesting.
Imagine, people with herpes rarely having symptoms
Yeah.
or never even having them.
That would be huge.
It would be huge. It
Yeah.
would really improve their quality of life.
Okay, so we're talking about preventing new infections
Yeah.
and helping the people who already have it. Are there any other benefits to a vaccine?
It's really interesting.
Right.
There's a link between herpes and HIV.
Oh, wow.
Studies have shown that genital herpes can actually increase your risk of getting and transmitting HIV.
Really?
So a herpes vaccine
Yeah.
could have this kind of ripple effect.
Okay.
It could help in the fight against HIV too.
So we could be talking about a vaccine that impacts two major global health challenges.
Exactly.
I could definitely see why the scientists are so focused on this.
Yeah.
But I'm guessing it's not easy to develop a vaccine, right?
You're right. It's not easy at all.
Okay.
There have been setbacks. There have been challenges.
Yeah, I remember hearing about a vaccine a few years ago.
Oh, yeah. A few years ago, there was a vaccine candidate. It looked really promising.
Yeah. but it didn't work out.
Unfortunately, in the larger studies, it didn't really protect people enough.
Okay, so what are they doing now?
Well, now there are several different approaches,
Okay.
all very promising.
Okay.
One of the most interesting ones,
Yeah.
it involves using a genetically modified version of the herpes virus itself.
A genetically modified version?
Yeah.
What does that mean?
So basically, they're taking the virus
Yeah.
and they're tweaking its genetic code
Okay.
to create a version that can trigger the immune response,
Okay.
but without actually causing the disease.
Oh, okay. So it's kind of like...
It's a very delicate process.
Yeah, I was going to say, it's like a balancing act, right?
Exactly.
So it's like the flu shot.
It's a similar idea.
Okay.
Like with the flu shot, they expose your immune system to a weakened version of the virus.
Right.
So your body can build up defenses,
Yeah.
but you don't actually get sick.
So you're giving your body a sneak peek at the virus so it can be ready to fight if it ever sees the real thing.
Exactly.
That's pretty cool.
So in the case of herpes, they're figuring out how to modify that genetic code to make it safe and effective as a vaccine.
Wow, that's really neat. Are they exploring anything else?
Yeah, there's another really cool approach.
Okay.
They're targeting certain proteins that are important for the herpes virus,
Okay.
like the ones that help it replicate and infect cells.
So instead of going after the whole virus, they're targeting its weak spots.
Exactly.
That's smart.
So by developing vaccines that can block these key proteins,
Yeah,
the scientists, they're hoping to stop the virus before it can spread
that makes sense.
and cause outbreaks.
Sounds like there's a lot of really cool research happening in this field.
It's an exciting time for herpes vaccine research.
Yeah, it makes you wonder, like, what's the future going to look like?
Yeah, who knows?
Will herpes even be a problem anymore?
Well, there's still a long way to go,
Yeah, I'm sure.
but the progress so far is pretty hopeful.
Okay, that's good to know. But even though we don't have that breakthrough vaccine yet, there's still things we can do now, right?
Yeah, absolutely.
To manage the virus
There are lots of things.
and live normal lives.
Yeah.
But this article seems to suggest that there's something missing,
You're right.
like a piece of the puzzle is missing.
Yeah, it's surprising, actually.
Yeah.
Despite how common herpes is
Right.
and how much it impacts people.
On healthcare systems.
Exactly. Even in wealthy countries, there just aren't enough specific programs for prevention and control of herpes.
It's strange that something that's so widespread hasn't gotten more attention.
Yeah, you would think.
Why do you think that is?
Well, honestly, I think it's partly because of the stigma around herpes.
Okay.
There's a lot of shame
Yeah.
and misinformation about it,
Right.
which makes people not want to talk about it.
Makes sense.
And that can actually hurt research efforts and public awareness campaigns.
Wow, so the stigma itself is kind of preventing us from making progress. I'd love to hear more about, like, how that stigma affects people,
Yeah,
the challenges they face,
absolutely.
and what kind of support is out there.
That's a really important part of this discussion, and that's actually what we're going to talk about in the next part of our deep dive.
Oh.
We're going to look at the human side of herpes,
Okay.
the emotional and social challenges,
Yeah.
the importance of being open about it,
Okay.
and how support systems can help people deal with this often misunderstood virus.
Sounds good.
Yeah. Hashtag TTS, the deep dive, episode 2024-1230, part 2 of 3.
So, yeah, we were talking about the stigma surrounding herpes.
Right, and it's hard to believe that, like, in this day and age, a virus like this still carries so much stigma.
Yeah. It really...
It's like we haven't learned from other things, you know?
Exactly. And it just goes to show you that people are still really uncomfortable talking about sexual health.
Yeah.
And herpes, unfortunately, it gets caught up in all of that,
Right.
leading to all these feelings of shame,
Yeah.
isolation, fear of disclosure. Right. It must be really hard to talk about having herpes, even with people you're close to,
It is. It is.
like friends or partners.
Imagine, like, constantly worrying about telling someone
Yeah.
and then fearing that they're going to reject you
Right.
or judge you.
Yeah, that must be a lot to carry.
It is. It can really take a toll on relationships,
Yeah.
intimacy, overall well-being.
You're just like going to the doctor and getting the help you need.
Exactly. It can prevent people from seeking help.
That's so sad. Just like they're being punished for something that isn't their fault.
It is.
So what can we do about it?
Well, it all starts with education
Yeah.
and open dialogue.
Okay.
We have to challenge these myths and misinformation
Okay.
that are feeding the stigma.
Yeah.
And that means talking about herpes in a factual way,
Okay.
but also in a compassionate way, you
Sure.
know, emphasizing that it's common,
Right.
it's manageable, and
Yeah.
it doesn't define a person.
Yeah, it's like we have to normalize the conversation, just like we've done with other health conditions.
Exactly.
Are there, like, resources for people with herpes?
Oh, yeah, absolutely.
Like support groups or anything like that?
Yeah, support groups can be amazing.
Okay.
They offer a safe space for
Eh.
people to share their experiences,
Okay.
connect with others who understand,
Right.
and learn coping strategies.
Okay.
And there are also online forums and resources
Oh, okay.
that can provide information and advice
Yeah.
and just a sense of community.
Right. So even though it can feel very isolating,
It can.
there are people out there who get it.
Right, exactly.
That's really good to know.
Yeah.
But those resources are for like the emotional side of things, right?
Right.
What about the physical symptoms?
Well, that's where the antiviral medications come in.
Okay, right. We talked about those before.
Yeah, they can really make a difference.
Okay.
They can reduce how often you have outbreaks,
Yeah.
how long they last,
Okay.
and how bad the symptoms are.
So it's not just about treating the symptoms when they happen.
Right.
It's about preventing them from happening in the first place.
Exactly.
That's great.
And another benefit is that they can reduce transmission.
Oh, right. To partners.
Yeah, by lowering the amount of virus in your body.
Okay.
They make it less likely you'll pass it on.
So it helps you and it potentially helps other people.
Exactly. It's a win-win.
It sounds like there are some really effective tools out there for people with herpes
There are.
to manage it
Yeah,
and still live their lives.
absolutely.
But what about like the ethical side of things
Hmm.
when it comes to developing a vaccine?
That's an important question.
Yeah.
Anytime you're talking about a sexually transmitted infection,
Yeah.
there are ethical considerations,
Okay.
especially when it comes to research.
Yeah.
We have to make sure that people who participate in trials
Yeah.
understand the risks and the benefits,
Right.
that their privacy is protected,
Makes sense.
and that everyone has a fair chance of being included.
Okay, so it's not just about the science.
It's not just about the science.
It's about being sensitive to the fact that this is a sexually transmitted infection
Exactly.
and making sure the research is ethical.
We have to be careful that we don't make the stigma worse
Yeah.
while trying to find a solution.
Right. We don't want to hurt the people we're trying to help.
Exactly.
That's a really good point.
And then there's the question of access.
Right. Like if we do develop a vaccine, who gets it first?
Exactly. Who gets priority?
Yeah.
These are tough questions,
Yeah,
and we
yeah.
need to think about them carefully.
Because a vaccine doesn't do much good if people can't get it.
That's right.
And there's another thing I wanted to ask about.
Yeah.
Mandatory vaccination.
Oh, yeah.
Like, if we have a herpes vaccine, should it be required?
That's a tough one.
Yeah.
It brings up all these questions about individual rights versus public health,
Exactly.
and there's no easy answer.
No, it's a really complex issue.
It is.
And I think it's good that we're talking about these things now,
I agree.
before a vaccine even exists.
We need to be prepared
Yeah.
to handle all of this in a responsible way.
It's interesting how science can sometimes raise more questions than answers.
It's true.
But it's good to have these conversations.
It is. It's how we learn and grow.
Right, and figure out how to move forward in a way that benefits everyone.
Exactly.
I think this is a good point to shift gears a little bit.
Okay.
We've talked about the impact of herpes on individuals,
Yeah.
the challenges of stigma,
Right.
the research that's happening.
Right.
But now I want to zoom out a little bit
Okay.
and look at the bigger picture.
Sounds good.
What could a herpes vaccine mean for the world?
Yeah.
What are the economic implications?
Right.
And how could it change our whole approach to sexual health?
Those are all really important questions. Hashtag TTS, the deep dive episode 2024-1230, part 3 of 3.
So we've talked a lot about how herpes affects individuals, but you were saying that a vaccine could have a much bigger impact.
Yeah, I mean, think about it. What if we could significantly reduce the number of new cases each year?
That would be huge.
It would be a total game changer, not just for the people who would avoid getting infected, but for our healthcare systems too.
Oh, right. Because if fewer people are getting infected, that means there's less need for treatment and all of that.
Exactly. It would free up resources to focus on other health issues.
Okay. Yeah, that makes sense. But are there any other public health benefits?
Definitely. We talked about the connection between herpes and HIV.
Yeah. How having genital herpes can make you more likely to get HIV.
Right. So a herpes vaccine could actually help us in the fight against HIV as well.
Wow. So we could be making progress against two viruses at once.
It really highlights how interconnected our health challenges are.
Yeah, that's a good point. I hadn't really thought about it that way before. Are there any other ways a herpes vaccine could help us build a healthier future?
I think it could also change how we approach sexual health in general.
How so?
Well, right now, there's so much fear and stigma around herpes, it makes people afraid to talk about it or even get tested.
Yeah, that makes sense.
But if we had a vaccine, that fear would go away.
So people would be more open to talking about sexual health.
Exactly. And more likely to get tested for herpes and other STIs.
Which would mean earlier diagnosis and treatment.
Exactly. It would benefit individuals and society as a whole.
So the benefits really go far beyond just preventing herpes. It sounds like we're talking about a ripple effect that could touch so many different aspects of our lives.
Absolutely. And we haven't even talked about the economic side of things yet.
Oh, right. What about the cost of treating herpes versus the cost of a vaccine? I imagine those numbers could be pretty significant.
They are. Think about all the costs associated with herpes, doctor visits, medications, dealing with complications. The World Health Organization estimates that we're spending billions of dollars globally each year on herpes-related healthcare.
Billions. That's incredible.
It is. And a vaccine could potentially save us a lot of that money.
Which could then be used for other things.
Exactly. We could invest in other health priorities or research new treatments for other diseases. It makes sense from a financial perspective, too.
It's amazing to think that one vaccine could have such a huge impact. It's not just about herpes, it's about creating a better future for everyone.
I think you're right. And it brings us back to those ethical questions we were discussing earlier.
Right, like how to make sure everyone has access to the vaccine.
Exactly. And how to approach the idea of mandatory vaccination. These are important conversations to have now before a vaccine is even available.
It's a good reminder that progress always comes with new challenges.
Mm-hmm.
But those challenges also give us an opportunity to learn and grow.
I couldn't agree more.
Well, this has been a fascinating conversation.
It has.
We've learned so much about herpes, the urgent need for a vaccine, and all the potential benefits that come with it.
And the challenges, too.
Right, the challenges too. But that's all part of the process, I guess. Figuring out how to move forward in a way that's ethical and benefits everyone.
Before we wrap up, I want to leave our listeners with one final question to think about. What are your thoughts on the possibility of mandatory herpes vaccination? It's a complex issue with no easy answers, but it's something we need to start thinking about now.
That's a great point. And on that note, we'll wrap up this deep dive. Thanks for joining us today as we explore the world of herpes and the search for a vaccine.